Good morning, Berlin. Hey, thank you. I'm happy to be here. I'm going to tell you a true story, just the honest facts of how it went down. So for part of my job, I work in the ICU. And sometimes I connect with my patients. On this particular week, I have a patient, and I go to see her every day. She smiles, we've talked, and she's touched my heart. She's been in the unit with pneumonia on a ventilator, but she's getting much better. Today, she's actually ready to be extubated, to have the tube taken out. And so after rounds that morning, we extubate her, a normal, everyday event. And her bed is right across from the nurse's station. And so it turns out that a few minutes later, when I'm standing there chatting, that I can hear her stridor. First a little bit, and then a lot of stridor. So my planned extubation is not going that well, but this is still a normal everyday event, and we go back and prepare to re-intubate her. We lie her down flat for the intubation, and she immediately obstructs completely. Within a few seconds, her sat goes down to 0. And a few seconds after that, we lose her pulse. She has a PEA arrest, and we start CPR. And what I want to know is, if this is your case, how are you feeling right now? And the actual detail I am interested in is, if this is your case, what is your inner voice saying to you right now? Do you hear it when it happens? Can you hear it? Life generally gives us lots of opportunities to practice this. Have you ever dropped your phone and cracked it? Yeah? What did you say to yourself when that happened? Right? It takes sometimes a little practice, but at this moment in this resuscitation, I'm standing there, I'm trying to do CPR and optimize my team and get an airway, and in the midst of it, my voice is calling me a stupid effing idiot and all sorts of worse things. My inner voice is critical and judgmental and sarcastic. And I used to think it didn't matter, right? Like, nobody else has to hear it. It's only happening inside my head. And I used to think it didn't matter to high-level medical performance or to your resuscitation skills. And then I started looking at the evidence, and that evidence changed my mind. Because it turns out that when you're standing there trying to run a complicated situation, your inner voice matters. It can lower your confidence. It can increase your anxiety. It can raise your heart rate. And most importantly, it uses up valuable cognitive processing power that would be better spent focused on this lady's airway. So I have this soundtrack constantly in my head. I think we all do, and it's very critical. How can we change that? Is it even possible? Well, this leads us to the concept of self-compassion, and the fact that you can train your inner dialogue and get better on this. This is a skill you can learn. In fact, elite athletes train on this, and I think we need it just as much as they do. The concept of self-compassion means talking to yourself the same way you would talk to your best friend, using the same tone, the same language that you would use with a close friend. And this helps us when we're trying to perform a difficult procedure. So self-compassion has been shown in the literature to reduce your heart rate, reduce sympathetic surges, reduce stress-induced immune responses. In practical terms, this means your hands are going to shake less when you're trying to feed the damn wire. Right? We want this. This can help our bedside performance. Because what I've realized is that when you're good at your job, it's not actually easy to take it up to the next level. You need to look for changes, sometimes quite subtle ones, to help you improve. But excellent bedside resuscitation isn't just about medical knowledge and technical skills. It's also about serious psychological skills. And so I'm there in my ICU. And we've done a cycle of CPR. We put an LMA in to buy us some time. She starts to oxygenate with that, and we get her pulse back, but I can still hear Strider through the LMA. And so I ask for a second doctor to be paged to come give me a hand. But my secretary, he's new, and he's terrified by this scene unfolding right in front of his desk. And so instead of quietly paging my friend, he puts out an overhead page. And I mean overhead to the entire huge academic trauma center. Oh, yeah. And oh, it gets better. And the page says, anyone with any airway skills, report to ICU immediately. Okay, guys, this is a true story. I heard that page, and a little part of me died inside and has never recovered, right? I felt ashamed immediately, so ashamed. We have been conditioned in medicine to view calling for help as an act of weakness, and I have just called for help in the most public way possible. And now, in the most humiliating way possible, too, now my inner voice is even louder. It's reducing my bandwidth even more. These are cases that hurt us. These are cases that lead us towards burnout. And burnout is something that we all need to care about, because we are all at risk for this. When you work in a high-risk profession where tiny mistakes can have life or death consequences, we're all at risk. And we all make mistakes. This is normal. We are all human. But we don't talk about them. We keep our tragedies and our failures hidden so we can look perfect on the surface and hide all of that under the waterline. Look happy on social media, but feel terrible about yourself inside. And the trouble is, when we stay silent through these cases, people can start to feel shame. People can start to feel isolated. And after years of shame and isolation, this leads us down the path towards burnout, depression, addiction, and suicide. Suicide for me is the final common pathway. I have 2 close friends who have died from suicide. One of them was my best friend from high school. He was a genius, an amazing, literate, lovely man. He was the MC at my wedding. And then 6 years ago, he killed himself. And I gave a eulogy at his funeral. And I still miss him every day. He could never talk about his fears, about his anxieties, and they overwhelmed him. And that's the price of our culture of silence. And I think I'm not the only person whose life has been touched by this. I think, in fact, we are all in this together. But I'd like to know for sure. So put your hands up. All of you, put them up. Up. Go. Put your hand down if you have a friend with suicide. Put your hand down if you have a friend with addiction. Put your hand down if you have a friend with depression. Put your hand down if you have a friend with burnout. You should buy a lottery ticket. He said he's got no friends. I'm sure that's not true. Oh. This affects all of us. This is our hidden epidemic. And we are all in this together. And we need to start training on the skills we require to reverse this. Skills including self-compassion. because I'm there in my unit, and about 50 different doctors come racing in. There's my boss, the chief of anesthesia, the chair of the ICU, there's half the trauma team, there's every intensivist I know. They all come jamming in. And then they ask, what's happening? And they're looking at the case, and they're judging my medical care. And there are enough doctors that some of them stay to help me, but there are, in fact, so many that a whole bunch of them just stand back at the nurse's station to watch and to gossip and to judge. And I feel overwhelmingly intimidated. And my ability to stay kind to myself is getting worse and worse. Because it turns out that self-compassion is not just a light switch that you switch on one day. It doesn't work like that. This is something you have to train on. You have to practice. And then you screw it up and you try again a different way. This is a work of years. It turns out for me that self-compassion is much harder than any other critical resuscitation skill I know. Resuscitative hysterotomy was easier than self-compassion. And so if you're not sure how you're doing with this, you can go to this marvelous website, selfcompassion.org. This is Kristen Neff's amazing work on self-compassion, and it has this quiz where you can see how self-compassionate you are toward yourself. I want to give you a couple examples from the quiz. You don't have to do any math or add up your answers. I just want you to reflect on where you are on this scale. Maybe tell your neighbor if you feel comfortable. Here's your first example. When times are difficult, I tend to be tough on myself. Are you tough on yourself? Where are you on the scale? And your second example. When I fail at something important to me, I tend to feel alone. Do you feel isolated after a mistake? Don't worry if you're almost always all fives. I'm almost always all the time, and we can work through it together. Because the fact is that this changes as you practice. You can start trying it and then retest yourself in 6 months or a year and see where you are. The other great thought experiment is to test yourself a few days before your vacation and then again the day after. Right? When I do this, I see a huge and frankly terrifying change in my scores. We get compassion fatigue, and we need to learn how to replenish our reserves. So I'm there in the unit, and even with all of this help, we still can't get her airway. She ends up going to the operating room for a primary trach by my ENT surgeon. So someone else saves the airway on my case, on my beloved patient. I feel terrible. But not only me, my team feels terrible. My nurses, my RTs, my fellows, we've all just taken a hit. And I need to figure out what to say to my team as we start debriefing, to figure out how to talk about this to help them recover. And whenever I'm not sure what to say to them or to say to myself, I think about what I would say to my close friends, what tone I would use with my close friends. Because these cases are difficult to talk about. But when you start practicing self-compassion, it becomes a little easier. And so let me tell you my favorite construct around this. I think you should all find yourself a failure friend. You all need a failure friend. This is your go-to person to talk to when you've screwed up. Now, you need to choose someone nice. Don't choose an asshole. Choose someone capable of empathy. Choose someone who understands your context. And so for me, I have one failure friend for the emergency department, and I have one failure friend for the ICU, and then I have 3 failure friends for parenting, because I have so many screw-ups with my kids that I need a whole team. You don't, oh, it's true. You don't have to tell them they're your failure friend, right? That might be weird. This is just the person you go to and you say, oh, I had this case last week and it's bugging me. Now, to be clear, you're not having M&M rounds with your failure friend, right? You don't need to tell them all the medical details. I, in fact, want you to do something a little bit harder. I want you to tell them how you feel. You tell them when you feel like quitting. You tell them when you feel like drinking. And if you've chosen wisely, they lean right in and they say, I know exactly how you feel because I've been there too, and we will work through it together. And that's where we start to support each other, because we have all been there. Everybody has had catastrophes. We may respond to them in different ways, but we have all been there. And so when you're actually trying to practice self-compassion and get a little bit better at this, there are only 2 steps. It's one of these things that sounds really simple, but it's actually sort of hard. These 2 steps are easy. The first one is you just listen to your inner dialogue. And if you can't hear it, you can try, dropping your phone or pouring coffee on yourself or some other mishap, and you'll generally hear it louder. Just listen. And then step 2 is figure out how to change your language or your tone to make it kinder, to make it more compassionate. And I bet you actually all already do this every day. For your patients and your families, do you ever change your tone when you're talking to them? Do you change your language to match what they need? Yeah, you do, right? And you can choose to do this for yourself because you deserve it just as much as they do. So I'm there in the unit, and she comes back from the OR. This morning, she'd been ready to be extubated and leave the ICU, and now she is back. She's on a ventilator. She is post-arrest, and she has a surgical airway in her neck. She's also wide awake and looking for answers. And so I go talk to her and her family to explain and to apologize and to give them the kindness and the compassion that they need to cope with this. And I find myself so much more able to give them the compassion that they need than I am to give it to myself. But I think maybe some of you are already pros at this. I hope that there are people who are excellent at this. And then my job for you is to turn your skills outward. If you're good at this, teach your patients about self-compassion. This has been shown in chronically ill patients to improve their medication adherence and their self-care. Teach this to your teams and your students, or even better, role model it for them. Show them how you recover from a difficult case and help show them the skills that they can use to adopt this. Teach it to your children. Teach your children to be kind to themselves when they make a mistake, so that they grow up to be more resilient than we are. Let's make sure the next generation's burnout rate is lower than ours. Self-compassion is a skill that you can use every day. This helps your bedside performance. It helps reduce burnout. It helps you recover. And you don't need to worry, in fact. It all just happens inside your head, so you can keep it a secret. You can secretly be nice to yourself on the inside and still keep your tough exterior, right? It can just be all happening in here. Because I go back into my ICU the next day, and the RT comes up to me. It's the same RT from the previous day, and she says, "The gentleman in the next bed is ready to be extubated." he was a known difficult airway. And he's ready to be extubated. And the question is, are you ready? Is your team ready? Have you recovered enough that you can walk back into your job the next day and perform to a high level? These cases make us afraid. But self-compassion helps us walk through that fear with a bit more courage and a bit more grace. So I have 3 things you can start today. You can start right now, in fact, and they're quite easy. You can just start listening to your inner dialogue, paying attention to what you say to yourself. Number 2, then, is to start practicing better self-talk, to learn phrases or words that work for you, and maybe then spread those to your teams and your families. And number 3 is to use those skills at empathy to take care of our community, to be someone else's failure friend and respond to them with compassion rather than with judgment. Self-compassion can make your work, your performance, and your life better for free, starting right now. I hear voices in my head, and so, guys, do you. But maybe if we all start paying attention, we can move us to a better place. Thanks for listening.
Okay, everybody, remember to log into the website and rate. Thank you for your comments and questions. I've been officially corrected on the Twitter-sphere. It is not Legos, it's Lego. So thank you very much for that. I love learning. Sara has offered to be everybody's failure friend. I'm not that good at it. Aurelia, can you offer us a few comments, please?
Most people said thank you for your honesty and your encouragement, and almost everybody agreed that we need to be more sensitive to depression, suicide, and addiction, as this obviously is a topic that affects people that we know. And they liked your comment that resuscitative hysterotomy was much easier than self-compassion.
I've tried both, yeah.
Yes.
I've tried both, and self-compassion is harder.
Somebody said that retrospective criticism from colleagues can be a very harmful and negative thing. I think this is something we can stress.
Absolutely. Sometimes it's even minor or offhand comments from somebody who probably isn't intentionally trying to say something difficult, but just isn't being thoughtful about it. But I think all of us have comments like that that we've taken home and that have stuck with us or that have hurt us.